Hi, in this video we'd like to talk about another common gynecological condition of the uterus, which is known as endometriosis. Now, this is a highly requested topic, and today let's get into it. So endometriosis is a condition where the uterus lining tissue, which means the tissue that usually grows in the uterus lining, is now growing elsewhere. Now, elsewhere means there are a few common spots. So the most common spots involve the fallopian tube, outside the uterus, ovaries, and other places as well. But in some rare cases, we do see these types of tissue growing in places such as the bladder, the anus, the pelvic cavity, and even in places very far away from the uterus or the reproductive system. This is all happened before, so we need to consider these type of cases as well, however rare they are. So because of the tissue being displaced, but they do still have the same property of shedding every month, just as the uterus lining will. So during your menses period, these tissue will thicken, and then if there is no fertilization that occurs, they will shed, and this is what happens in your menstruation cycle. So these tissues that grow elsewhere, they will carry out the same process, which leads to some discomfort, and in some cases severe painful menses. So one of the key symptoms when diagnosing endometriosis is that you have a history of severe menstrual pains. So for commonly they are found to be growing on the outer exterior of the uterus, and when they shed, these types of tissues have no exit because it is not found in the uterus lining. If it's shedding in the uterus lining, it will exit via the vagina. But for those tissues that are found to be growing elsewhere, they have no exit way, and over time, accumulation of these shed tissues will lead into scarring tissue formation or even adhesions. So adhesions will cause organs and different types of tissue to stick together, which will affect its function and also cause even more severe complications. So diagnosis for this condition is that we will use ultrasound, transvaginal ultrasound, and also a diagnostic laparoscopy to take a look at your uterus and also look at the positions of these displaced tissue. So once they are confirmed, treatment will involve using laparoscopy as well to remove them one by one. Once these tissues are removed, you will no longer actually experience painful menses, and then your reproductive abilities may be restored as well. Standard treatment for this type of condition usually is hysterectomy, which is something that our hospital is strongly against, because hysterectomy, we believe it is a form of castration and over-treatment. You can keep your uterus, you can also continue to get pregnant and start a family even though you do have endometriosis. You do not need to have it removed. You can come to us and get it treated and recover from this condition. To find out more, please visit our website and also leave us some questions down below.